Could you please give me a quick, brief background of yourself?
So I'm Don. I'm a therapist at PIH Health. Been working at 10 years. So I've been working here the whole time. Yeah.
Oh, okay. So I have a couple of questions for you. My first question is regarding your position. How has dualism affected your coaching methods? And I don't know if you're aware of dualism, but it's of like mind and body, how your thoughts affect your actions. How does that play in your part as a physical therapist?
It plays a huge role. So um, you could get the patient stronger, you can stretch them out, but if you don't address the mental health awareness, um, then then you can only get so far, at least short term. So
Okay.
long term, things will come back because uh, so-called the mind controls everything. Okay.
Okay. So there always seems to be a change in your profession because of constant findings and research. Is the change in your profession slow or rapid?
Mm.
And if you can, could you please provide an example? So,
Mm.
like slow, I mean as in like it's not
It's
really noticeable, and then rapid as it's constantly changing, where you have to
mm,
adapt to different techniques.
yeah, it's concept-wise for unity and managing a patient um, is changing pretty rapidly. Uh, so there's a huge push for that. So then we're more unified in the way we think. So patients can see more continuity um, and slow in terms of uh, uh, managing the patient as a whole. So everything's more integrative. The body works more integrative, but managing it one body part at a time is can give limited results.
Okay,
Yeah.
thank you. So sociology has to do mainly with race, gender, and cultural backgrounds. Um, does this factor in the participation for your profession? How so?
Does it influence it?
Yeah.
Oh yeah, for sure. Well, you have to respect race, culture, uh, um, and beliefs. So from there, same thing like the mind, religion, all that plays a factor in how people will function, uh, 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 treat their body. So uh, it's important to factor in.
How about in your profession? So, like, as a physical therapist, is
Yeah.
it more like women being a part of it? Is there more men in it or more
Oh,
women?
uh,
Like, is it stereotypical?
no,
No?
no.
So
It's pretty well diverse.
it's diverse. Okay. Um, as a former athlete, motor behavior is very important in acquiring a skill and developing it to become more elite. Is your methods in teaching unique in some way? Is in teaching unique in some way to help the individual strengthen his abilities?
Hmm. Well, pain dictates movements. Uh, Pain can shut down efficient movements. So as an athlete, you got to move efficiently for uh, for optimal performance. So as a physical therapist, we address with things of pain that should help irregular movement. So
Okay, thank you. And I don't know if you're aware of imagery. Imagery is a mental technique
mhm.
proven to allow individuals to become more skillful and agile in their area
Mhm.
of interest. Do you apply this method as well to your daily practice?
Mm, no, um, not so much, but for chronic pain, we do. Uh, um, because with chronic pain, movement can get confusing with pain, even though there's nothing wrong with the tissue. So using imagery to get the patient to see that they're able to is one method. Because with pain, it can cause them to feel like they can't move or don't want to move, and then the body and the brain um, believes that it can't. But if you use imagery to help the patient see that they can move, then that can help kind of separate what is painful and what is reality kind of thing.
Oh, okay.
So yes.
And does motivation or arousal affect it or limit the outcome? So arousal, like leading, like how they feel throughout maybe the exercises. Maybe they're just depressed, or they're, you know, coming in, they're just not.
Yes, yes, of course. So if they're eager to work out, if they're emotionally distracted, then that can depress movement, efficient movement. That they work harder to make it happen. So obviously, if they're eager to, they're motivated to, then working as a team, patient and therapist, will get better results in theory.
Okay. Um, from a biomechanist view, what type of sport position have you found difficult to analyze with biomechanical instruments, if you have done so?
Mm. There's not one. Uh, Something to compare with studies wise, if you're talking about evidence based, the sports that aren't heavily researched. So obviously, open athlete, baseball is golf is it's easier. Running is easier because there's something of a reference point.
Oh,
Yeah.
okay. Because of the intense movement being asked throughout a contact sport, what type of movement is overlooked, and what suggestions do you have to help prevent that? So,
What movement is overlooked?
yeah. So, for example, football, one of the movements is like jumping, because if you land wrong, you could hurt yourself really bad.
Mm.
So, do you know an example that you could provide?
Mm. Mm. Keeping it simple, maybe like just a basic heel raise, how efficient they are to go up over their big toe without
Oh.
buckling in and out can kind of give you an idea of transfer force up and down the body.
And then you can actually hurt yourself very bad
Mhm.
if you don't do it right.
From my experience,
Oh.
in theory,
Oh, okay.
but not proven as much as buckling of the knee.
Okay.
Yeah, when you squat, jump.
Okay. Thank you. And can you briefly describe VO2 max and how it affects workouts or play?
VO2 max?
Yeah.
Mm. Efficiency of breathing?
Yeah.
Or, so, uh, energy efficient, energy expenditure. So oxygen is important for tissue. So, kinda, pretty sure it's been shown through a lot of research, but I'm not unaware. But if the body has to work harder, then it poops out faster. So inefficient movement causes dysfunctional tissue. Had repetitive use causes pain.
Oh, okay. My last question would be, sports constantly forget the limits of an individual player and push their boundaries through performance, leading to burnout. It's become dangerous at times because of low amount of fluid intake, lack of carbohydrates, and high temperatures. What type of resistance training should one do to enhance their muscular strength and endurance?
Depends on the sport.
Let's say football, because they're more in the outside for the heat.
I'm not sure that transfers over.
It doesn't?
I'm not sure.
Okay. Could you provide a sport?
I think strength carries over to strength. Obviously, fitness capacities is what we're talking about.
Okay.
The whole athleticism may play a bigger role, but I don't think breaking it down like that can carry over to whether you can hydrate less or not. I think hydration is, so. Uh, so I'm not sure.
Okay. And for proteins and other supplements, do you think it's required to have best performance or optimal performance?
Sports science and nutrition, yes,
It is.
but yes.
Even like regular protein shakes and
I say,
or just nutrition
yeah, sports
overall.
sport science is become more and more popular.
Mm.
And it's been validated and it's very more detailed and individualized. If you're with appropriate testing, so I think it can